Yeah, I won't be quiet today. Everybody ready? Well, thank you for joining us here this morning, and I'll offer a few comments with respect to the provincial preparedness as we face in this nation and in this province a new variant of COVID and Omicron. A variant that we are, becoming increasingly aware is much more transmissible than any other variant that we have faced, including the Delta variant. We also are quite aware that Omicron is very present in Canada, and it is also present here in our province of Saskatchewan. We're seeing community spread in other provinces across this nation, and I think as of today and moving forward, us in this province of Saskatchewan should also assume that community spread is happening in our province, and we should conduct ourselves accordingly. Again, we go back to the most effective tool that we have in addressing all of the variants, including Omicron, is vaccines. Now, today in Saskatchewan, we do have 88% of our residents have one dose, 83% have their second dose. We have delivered now over 160,000 booster doses to those that are eligible in that 58-year age category and up. That represents about 38% of Saskatchewan residents have went out and gotten their booster dose, with many more booked to receive it in the days and weeks ahead. Today, currently, that booster dose is eligible. People are eligible for that booster dose when they are 50 years of age and have a five-month interval since their second COVID vaccine that they received. Effective Monday, December the 20th, we will be opening up that eligibility age to all of those 18 years and older, and we'll be reducing the interval from your second dose to 3 months. So that's 18 years and older, reducing the interval from 5 months down to 3 months. This will provide many more Saskatchewan residents the opportunity to go out and receive their booster dose of COVID-19 vaccine. We have vaccines available in about 241 locations in over 140 communities across the province. A list of all of those locations are attached to the news release that we are releasing here this morning. That news release is available on the Government of Saskatchewan website, and we would urge everyone to go out and have a look at a location near them and make an appointment ultimately for their booster dose of vaccine. Very effective, likely the most effective thing we can do in preparing for Omicron to be present in our communities, which it most assuredly will be in the weeks and months ahead. Our testing capacity in this province and our testing convenience, the convenience that we have in accessing a test has greatly increased over the last number of months. As we know, we have our publicly provided PCR tests for all of those individuals that are experiencing symptoms. We also have added to that a number of private PCR and rapid test locations for folks that may be traveling, for residents that may require the proof of a negative test for whichever reason. In addition to that, we have also distributed over 8 million rapid tests to over 250 locations around the province as of today. They are available in your local fire halls, in your municipal offices. They're available at SHA testing sites as well as vaccination sites. They're available at a number of co-op locations, at malls, at libraries, at our schools, as well as our local chambers of commerce. Those are all locations where you can pick up a rapid testing kit. Again, in the news release that's available on the Government of Saskatchewan website released today, has listed each and every one of those locations where you can pick up one of these rapid testing kits, and we would urge Saskatchewan residents to do so. We would urge you to go out and pick up a rapid testing kit and have it in your home and to use it. To use it when you may be going out to visit a friend or family member that may be elderly or immunocompromised. Take a quick test before you go visit those members that we love. To use it when yourself or your children or someone in your family may have been in a larger crowd, or you may feel that you may have been exposed in some way. Use that test. Have it at home. Have it available, and most certainly use it. Testing is much more accessible in this province, but it's also normalized, and it needs to be more normalized in the weeks and months ahead. It is a very effective line of defense that we ultimately have. It's a line of defense that is effective at slowing the spread of all COVID variants, in particular the Omicron variant that we are facing today and will be facing in the weeks ahead, and it'll help us slow the spread ultimately of that variant in our province and in your community. So two things today that we would urge Saskatchewan residents 18 and over to go out and make an appointment for their booster dose. A very effective decision that you can make in slowing the spread of COVID-19 and most importantly, slowing the severe impacts of COVID-19 and ultimately slowing any hospitalizations that may result from that. And two, go out to a location near you, pick up your rapid testing kit, have it in your home, and be ready to use it at any instance should you feel you need to. These are the tools that we are making available to Saskatchewan people, and these are the tools that ultimately we are going to have to utilize as Saskatchewan people as we combat the Omicron virus that is arriving here in our province. With that, I'll take any questions. Yeah.
And how concerned should Saskatchewan people be in relation to this, even because our numbers are
right? So yeah, our numbers today are in a reasonable position. But as we look ahead and prepare for the Omicron variant, which is part of what we're doing today, and there's ongoing conversations with respect to that, we do see and we're aware of what the federal government's recommendations are. At this point in time, there's no provincial recommendations against international travel. We have in this nation, and we feel strongly that we have some of the most robust protocols available in any country or any place in the world when it comes to not only international travel but also inter-provincial travel. First, you need to be vaccinated in order to fly in this nation. Second, on return from any international travel, you're getting a test before you board the flight. You're now receiving a test on arrival back into Canada. If we were to add any suggestions or recommendations to all Saskatchewan people if they're going to be traveling either interprovincially or internationally, we would say first and foremost, exercise caution in your travels. You should assume that Omicron is present wherever you are in the world, as you should assume that Omicron is present here in our Saskatchewan community. Second, booster doses are now available as of Monday for anyone 18 years and older. We would encourage you, if you're traveling anywhere in Canada or around the world, to go out and get your booster dose as soon as possible. It is a great line of defense against all COVID variants, including Omicron. And third, we would say, go out and get your rapid tests. Have them on your shelf at home. We understand if you're traveling internationally, you're going to test as you leave the country you're in. You're going to test on your return into Canada. We would say have some rapid tests available on your shelf at home, and in the days following, you may want to, for your own assurance and those around you, do a couple of additional tests to ensure that you are monitoring your personal situation, reducing the risk not only to yourself but ultimately to those around you. These are the layers of protection that we would advise Saskatchewan people to follow if they are to travel either interprovincially or internationally. But there's no going to be no provincial recommendation against international travel.
Why are we reducing the eligibility, or sorry, the time frame between the second dose to the third dose from 5 months to 3 months? And do we have data that shows there are breakthrough cases after 3 months?
I don't believe we have data in Saskatchewan. I think we're starting to look at some data, and this would be a good question for the folks at the PEOC table, but from my understanding is there is some data in other areas of the world where there are some breakthrough cases, and so our shortening of that time frame is essentially to ensure there are more people eligible in a shorter period of time so that we can have more people in this province that ultimately do have their booster doses. It is proving to be effective against this variant that is arriving in Canada, and most certainly we should assume is in our communities today as well.
Do we have the supply for this?
The vaccine supply? Yeah, I believe we have over 400,000 doses that are available here today. Assurances from the federal government that there will be access to more doses. There's an urging from the federal government for us to do everything we can to make these booster doses available to as many as possible. So we do have supply on hand today, as well as assurances from the federal government that supply will continue. Also a parallel assurance of supply when it comes to the rapid tests that we're making available across this province. We have 8 million distributed today. We have a standing monthly order of 4 million per month with the federal government into the months foreseeable. And we have assurances from the federal government that there will be ample supply of rapid tests. And so we're encouraging Saskatchewan residents, all Saskatchewan residents, to have one of those tests in your home and use it when you feel you need to.
On rapid tests, other provinces
Yeah, we have, and we've been in discussion with the Pharmaceutical Association as well as others on where we can make those tests available, and we want to make them available in as many locations as possible. That's why we engaged, for example, with the Federated Cooperative to open up a number of sites there. That's why we have them available at municipal offices, again, some hours there, but fire halls as well have them available. Our schools have them available for those that have school children, as well as libraries, malls, and if there's other locations, we would ask them to reach out to the government of Saskatchewan, and we want to make these available in as many locations as possible, ultimately, so they end up on your shelf in your home, so that when you need one, you have it right there. You don't have to go out and get it.
You've spoken earlier this year about the concern of reacting to over-restrictions, excessive restrictions at various times. I think you said at various times it's not as successful. But I'm looking at yesterday's federal announcement, and I'd like to get some sense of what you think the reaction of the public might be, who's telling people who book trips and stuff that they can't travel right now, might be the kind of thing in which people would react kind of negatively. Do you think Ottawa was handling that properly? Do you think Federated
Yeah. Yeah, well, I do enough, judgment or reflection on federal government decisions. Listen, this is a time for us to come together across this nation. We have a challenge in front of us yet again. After 21 months of facing various variants of COVID, we likely have the most significant challenge ahead of us in Omicron, as it looks to be many times more transmissible than anything we've faced thus far. Many questions and discussions with respect to the severe outcomes of Omicron, but there's no doubt that the transmissibility is much more than we've received. So we need to do what we can to limit the spread, in particular the community spread in our communities. That's what what we're speaking to today, is to ensure that we are providing Saskatchewan people with the tools available to them to limit just that with respect to community spread. When it comes to international travel, we understand that many folks in this province and likely across the nation have made plans to see likely friends and family that they possibly haven't seen for some period of time. We firmly believe that the very robust protocols that we have in place for all Saskatchewan people, at least, are quite capably keeping Omicron that may come in from a travel perspective at bay. We've had a few cases here that are travel related in Saskatchewan. I think we should assume that it is being we have community transmission of it ultimately in our communities. But with the protocols that are in place, testing before you get on a plane, ultimately testing on your return to Canada, and with the added advice that we are providing here to go out and get your booster shot before you travel, the added advice of being extra cautious wherever you are in the world or in Canada in your travels, and then have those rapid testing kits on your shelf on your return and utilize them in the days following. Most certainly, any travel-related cases that do arrive in Canada are going to be minuscule or going to be quite small in the scope of what we're seeing in community transmission in other provinces. We really need to turn our focus to doing what we can as individuals in our daily lives to keep that community transmission at a minimum, and ultimately to whatever rate hospitalizations will arrive with the Omicron variant, we're preparing for what that might be as well.
The gap for kids to get their second shot is 8 weeks right now. We saw the booster program kind of get down. Is there a plan for kids to maybe get after 4 weeks, or some people calling for that to change?
Yeah, no, the gap that we have for between first and second doses for our 5 to 11-year-olds will remain the same, and there's no booster dose yet that is eligible or available for those under the age of 18. What we're doing today is greatly expanding the eligibility that we previously had of over the age of 50, 5-month interval since your last dose, to the age of 18 and over, and a 3-month interval of your last dose, and we feel this is very much going to fill up any vacant slots that we had in our vaccine eligibility as we look at it today. We're actively looking at it if there's some opportunities for us as the Saskatchewan Health Authority to expand some of our vaccination capacity over the Christmas season, and we might have more to say on that in the days ahead.
Does this booster change? People with AstraZeneca, are they eligible this time frame now, or what's
Well, I would say, in a way, in Saskatchewan, as you know, in the early days, we had we were prioritized for some AstraZeneca shipments. We received, in particular in Regina here, a significant number of AstraZeneca shipments. As you look back through the number of months, folks that had one AstraZeneca and then possibly an mRNA vaccine or two AstraZeneca, they have been eligible for that third and sometimes even a fourth shot in the case of folks that had two AstraZeneca shots. In essence, they have already had their booster shot, but my understanding is they'd again qualify if they're now 3 months from that previous booster shot. So in a way, there's some degree of being fortunate in the fact that we do have a number of folks that already do have their 3 shots. And for that we're grateful. But this is again opening up to the broader population and essentially, to your question, Mickey, trying to get as many booster doses available to as many Saskatchewan residents in the advent of what we know and what looks like most assuredly is going to be a significant wave of Omicron across Canada, and that will include our province and it will include our communities. And so we're providing the tools to Saskatchewan people here today. We're asking them to utilize and avail themselves of those tools and asking them to conduct themselves today. Unfortunate, I know, after 21 months of dealing with COVID-19, that we need to today just conduct ourselves in our communities with a significant degree of caution. It doesn't mean we have to stay at home. It doesn't mean that we can't do the things and see the people we know and love, but use the tools that are available that were not available a year ago. Use those tools as effectively as we can to slow the spread of this virus and ultimately keep our family and communities safe.
Is it fair to say that provinces are more unified when it comes to tools to address this new variant than provinces have been with other variants in the past?
I think there's been a fair amount of unity and certainly a fair amount of discussion and probably more discussion than ever in the history of our nation among the provinces on how we are addressing COVID in our respective jurisdictions. We've had weekly, bi-weekly calls throughout the last 21 months at the Council of Federation table, and for that I'm thankful. It's been helpful, I think, and I think other provincial premiers would speak and health ministers would speak to the same benefit that we are all receiving. So I think as we find our way through this, we find that we have more and more tools available to us, and provinces most certainly making those tools available to the people that they represent. And we on our call with the Prime Minister the other night, we again discussed the opportunity for some of the Merck and Pfizer pills that ultimately will be hopefully available in the weeks and months ahead. Those may help us hopefully in even this what we face in Omicron. They're going to have to arrive fairly quickly, I would say, as this seems to be an awfully aggressive strain. But that is yet another tool that we ultimately hope to make available to Canadians and to the people in this province. And I think other premiers would share in that sentiment. So the tools that we have available are increasing. A year ago, we had very few.
Has the updated our modeling to reflect
Yeah.
what Omicron will look like?
Yeah, we were in discussions with Dr. Shahab this morning, and with respect to that, and there's some difficulty with incorporating what Omicron will ultimately do to the modeling, but they are working on their best estimates with respect to what that might look like. And so I don't know when they'll actually have it in a form where they might want to deliver to the public, but Dr. Shahab most assuredly is looking at what's happening in not only other areas of the world, but other areas of Canada as well with Omicron. Adjusting which, sorry? Restrictions because of Omicron. I think, we're always looking at, the tools that we have to address, what we predict might lie before us. Public health measures are part of that discussion all the time. We saw Ontario yesterday do make some moves with respect to large gatherings, for example. I think over 1,000 are reduced to 50%. We're not at that point here today. Most certainly, as we look at today's numbers, are in a relatively strong position, but we most certainly are, very aware as to what Omicron is bringing to Canada, and we see it happening in other provinces, and what it ultimately we expect is going to bring to Saskatchewan. So we're not, actively discussing what an increase in public health measures would look like today, but we're watching this literally on a day-by-day basis. What we want to do here today is to ensure that all of the tools that we have available are available to Saskatchewan people, and what I'm saying here today is asking Saskatchewan people to avail themselves of those tools. have that rapid testing kit on your counter or on your shelf at home. Utilize it. Don't let it sit there and collect dust. Utilize it. It is a very effective tool in identifying if you've been exposed in much quicker fashion than maybe what we had available a year ago, where you went and sat in line at a rapid testing site. You can do this now virtually in 15 minutes, and if it's a test result that's not desirable, you can take the appropriate action literally days sooner than we were able to a year ago. So we have some very effective tools here today. What we want to do is and what we're doing here today is just reminding Saskatchewan people of where those tools are, where they can access them, and encouraging them to go out and make them available to them and their family.
Are you planning to travel interprovincially or internationally over the holidays?
No.
Have you made a travel recommendation to any of your ministers that they not travel?
No. Well, the recommendation that we have here today is for all Saskatchewan people, whether they work in the public service, whether they work in the private sector, whether they're elected.
On that recent call between other premiers and prime minister, what sort of subjects did you bring forth on behalf of Saskatchewan? What were your takeaways from that call?
All premiers had the opportunity to speak, and we did as well from Saskatchewan's perspective. And understanding where we are today, the call actually was very much an informative call on what we're seeing in other areas of Canada with respect to Omicron. What we can do collectively, to the point earlier, to ensure that we're slowing the spread of Omicron, and we're discussing a number of those items right here today. As we look forward into the next number of weeks and months, community spread of Omicron is something we really need to pay attention to as individuals across Saskatchewan and across this nation. We discussed that particularly on the call. We did discuss the travel recommendations that the federal government was going to make. There was no, I don't think there was any province that at that point in time had decided, where they were going to fall in with respect to any provincial recommendations that may mirror the federal recommendations, or may just be silent as to whether there's going to be a provincial recommendation. What we're seeing now, I think, today, yesterday, and likely throughout today and into tomorrow, is a province falling somewhat all over the board on that with respect to that. And we mustn't keep our eye off the ball. It's community spread that is going to be the challenge in the weeks and months ahead. We have a very robust system and protocols in place for travel. We most certainly are going to ask Saskatchewan people to follow all of them and more with respect to not only international travel, but interprovincial travel as well.
Jumping back to booster doses, are we looking at any other countries who have lowered that interval to 2 months and wondering what they're doing? Are we copying them?
I'm not aware of other countries. This was a question and a discussion that happened with our chief medical health officer, our medical guidance team here within the Saskatchewan Health Authority and the Ministry of Health. The goal of it is essentially to get out as many booster doses as we can in as rapid a fashion as we can. That is the goal, is to have more people with that third dose in a shorter period of time.
Do we have the healthcare staff available now to meet the demand of this winter?
We do have open appointments as we speak right now with the 50 plus 5-month intervals. So we expect those appointments to fill, as well as the Saskatchewan Health Authority is working quite closely right now on, are there some opportunities to provide some additional clinics throughout the Christmas season in communities across the province. And as I said, if we're able to pull that together, we ultimately will have that information as soon as it's available. But the goal is to ensure that the capacity that we do have out there today is being utilized to its fullest in the advent and the expectation that we're going to have community spread if we don't already here in the province. Yes, there has been some thought with respect to that, but in order to bring back, those mass drive-through clinics, we again have to slow some services across the Saskatchewan Health Authority, and so that is the balance: is do we want to again slow services in order to bring back some tremendous vaccination capacity. As you know, we've returned about 90% of the folks that were redeployed throughout our fourth wave of this pandemic back to their original positions. We had preserved 10% of those folks are still out there offering the current vaccination capacity that we have. And so it has been talked about, but we haven't decided to go that route as of now. As we do have significant capacity out there, I think about 241 various locations across the province through the Saskatchewan Health Authority, as well as a number of pharmacies that are participating. But we are looking at, there are some other providers that may be able to expand or start help us man maybe some additional vaccination clinics over the course of the holiday season.
What's your advice to people, I know you talk about rapid tests, but we're 9 days for Christmas, total community spread limiting it, people are going to probably see more family. What's your best advice? What's public health advice here in Saskatchewan?
Yeah. Go get your booster dose. Have your rapid tests on hand. Testing most certainly is normalized, and I don't think anyone is going to require someone to have a test. But I think most people are most certainly willing to have a test. In particular, as we come together with families with multiple generations, from the very young to sometimes the elderly, and an array of various potentially immunocompromised individuals that may be in your family. And so I don't think it's out of line at all to have a testing. Having testing kits available. Those that choose might want to try them, to have them available at least for your family. Testing is much more accessible and is much more available in our communities than it has ever been. And I think for the most part, it's normalized across communities in Saskatchewan. And so, I think it is a very, very effective tool in identifying where one may have been exposed in a much quicker fashion than we've ever been able to be. And you compile that with the booster doses, as well as this is time for us to exercise a greater degree of caution. Not only if we're traveling abroad or traveling in other areas of Canada, but for us in our community as well. We should conduct ourselves with the pretense that Omicron is here, it is present, and it quite likely is spreading in our communities.
Is every positive PCR test getting screened for Omicron?
I believe it is, yes. Yeah, I believe it is. And I believe all of them, including the most recent one, have been travel related, and we've been able to isolate those.
Are you guys going to start to release where the areas are that these variants are popping up? I know that they're not publicizing it as privacy concerns.
Yeah, I don't. Yeah, I think, and I think that's exactly right. Is they're not publishing the specific communities due to some privacy concerns that may be problematic with that.
As cases grow, will maybe we start publicizing that information to start
Yeah, that's not a decision that I would be part of. It'd be a decision that our probably legal and medical communities would make on when they might start publishing locations. I think when we see what's happening in other provinces and other nations is from this point on, we should just assume that all COVID actually is the Omicron variant, because it quite likely will be in the weeks and months ahead, and we should conduct ourselves accordingly. It's much more transmissible, and we just need to take an extra degree of caution with our hand sanitizer, with our washing our hands, with our rapid tests, with going out and getting our booster shots. It's unfortunate after so many months, and I know everyone has COVID fatigue. I know I have COVID fatigue. I would like nothing more to never talk about COVID again, but I also know that we're being faced with yet another challenge here, and I just once again would say that Saskatchewan people are much stronger than this virus, and we are going to find our way through it, whatever variant they throw at us, and I have the utmost faith in what we're going to do in the next few months.
Once we have the updated modeling, can this government commit to releasing it to the public as other provinces? We try to release what we have as long as it's in a form that can be credible and be released ultimately by Dr. Shahab, as generally who releases that. I do know right now that they're having some challenges in with respect to Omicron, because it is spread around the world just quite very, very rapidly. We've seen I think today 98% of the cases in South Africa are Omicron, the Omicron variant. We see it increasing daily in the UK, and we're seeing that now in provinces in Saskatchewan, and so the challenge is really to bring the modeling together at the speed and pace that Omicron is actually spreading around the world. And so again, I think for us as people of this province is you can assume a few things. It's much more transmissible. Some are saying up to 5 times more transmissible than the Delta variant. Some are saying it may not be as as impactful. It doesn't put as many people in hospital as the Delta variant. That may be true, but I think at this point in time, it's incumbent on all of us to do what we can to slow and stop the spread to the greatest degree possible in our communities. So booster shots are available, make your appointment. Rapid tests are available in a location near you. Go out, get them, have them in your home, use them. Use them in your course of normal weekly life for you and your family. And let's just be cautious in what we do for a while. I'm not saying that we can't go out and do what we normally do, but let's just have an extra layer of caution in doing just that. I myself took a rapid test this morning, just thought I would take one. I've had a busy week. I'm going home now. I'm going to switch communities in the next day or two, and I thought I should just take a rapid test to have a break if something should not be right, and so I did that this morning, and I think I'll likely do one whenever I feel appropriate in the days ahead.
What do you expect your Christmas plans to look like, and will you be asking any family gatherings to do that?
Oh, my Christmas plans? Oh, my Christmas plans are going to be very low key. They're going to be at home. We're fortunate that both our kids are going to be able to join us. I'll have some rapid tests available. Ultimately, I will be, having a little bit of visit with family and friends. We have our annual hockey games with all of my children as well as my nieces and nephews. I don't win that hockey game anymore, but I'm happy that they still invite me to play.
How many cases of Omicron does Saskatchewan have?
I believe it's 5 total, if I'm not mistaken. Yeah, but again, pardon me?
Do you have an upgrade? Because we have 5. Do you have an upgrade for the
No, I don't know if there's any increases in that today or not. But what I would say, even though those case numbers are remarkably low, even though our general case numbers are in a very solid position here in Saskatchewan, as we see what's happening and how quickly this new variant is moving around the world and even in other provinces in Canada right now, we should assume it's in our community, and we should assume that every case is Omicron, and we should conduct ourselves accordingly. We have tools available, or I'm asking and urging Saskatchewan residents to avail themselves of those tools and to just conduct themselves in a cautious manner in the days ahead, and in particular throughout the holiday season. It is a time where I think those tools are making and providing us with the opportunity to see family and friends, but let's use the tools that we have to keep ourselves safe. Thank you, everybody. I always forget to put this on after. If I don't see you again, I may. Merry Christmas.